Well, I actually didn't notice. It was my mom.
I remember she was sitting over a table. It was right around Christmas time, and she was sort of hunched over. Her posture had never been the best, but I never really thought much about it. But she was hunched over like this, and I noticed that she had sort of a hump on the upper right side of her back. And I remember putting both of my hands on her back and noticing that one hand was up and the other one wasn't. It wasn't even. I actually have a very good friend who had been to the Virginia Spine Institute about 8 years ago for some neck issues, and he couldn't say enough great things about VSI. So when he heard, he's the first person I went to for some advice. He said, you can't mess around, they're the best.
Were you able to enjoy camp? When I first met Alex, she was just over 13 and a half years old, and she came to see me for a second opinion regarding her scoliosis.
He's amazing. He's really nice, and he didn't talk to me like I was a little kid, which was good because it just, like, he explained things the way he would to my mom or something.
He didn't talk at her, he talked to her. And she really appreciated that. I think they connected pretty early on.
The idea that Dr. Good was somebody that she trusted, I had a higher confidence level that she was going to share with us, not just how she was feeling, but maybe even what she was thinking about it.
I think that's something that just comes with experience. The more you work with young people, you are able to appreciate how intelligent they are. The majority of these patients are very involved in their medical decisions and understand and are concerned about their conditions. So I always try to speak first and foremost to the patient and identify with them, and then also make sure that the family members have all their questions answered.
We, of course, did our homework as parents do, and it became quickly evident that he was an expert in his field.
Dr. Good's level of experience doing this was a big reason why my fear level went down.
At this point, she's back to the majority of her normal activities. She was able to participate in summer camp and use the water slide and do most of the activities the other kids are doing.
The entire staff, from the folks that are answering the phone and meeting you, to especially the physician assistants, the PAs, both here in both in the examination rooms and at the hospital, are all part of the same team. So you feel a little bit, I don't know, protected, like everybody's on the team. Everybody's looking out for our daughter. And that, well, I didn't expect that or have any other experience before that would prepare me for that, but I liked that a lot.
I really like Dr. Good. He's awesome.
You just want to see your daughter get through okay so that she's still smiling and able to walk and do all the things you want her to do.